Today's patient is a 27-year-old man who had been experiencing tinnitus, itching, and hearing loss in one ear for 2 weeks. His symptoms began after repeatedly cleaning his ear with cotton swabs. Despite taking medication several times, the symptoms did not improve, so he came to see me for evaluation. On endoscopic examination, I found a thick fungal debris covering the entire ear canal and the eardrum. Tiny fungal colonies were clearly visible on the surface. Repeated use of cotton swabs can irritate the skin of the ear canal, remove its natural protective earwax, and increase moisture from inflammation. These changes create an ideal environment for fungi to grow, leading to otomycosis, also known as a fungal ear infection. Common symptoms include itching, ear fullness, hearing loss, tinnitus, and sometimes ear pain. Under endoscopic visualization, I carefully use specialized instruments to separate the fungal debris from the walls of the ear canal and the surface of the eardrum. Once it was fully loosened, I gently removed the fungal plaque with forceps. Any remaining fungal material was then cleaned away using a cotton applicator moistened with povidone iodine, leaving the ear canal completely clear. Immediately after the procedure, the patient's hearing improved, and the itching, tinnitus, and blocked ear sensation resolved. If you frequently experience ear itching, avoid inserting cotton swabs or other objects into your ears. Instead, seek evaluation from an ENT specialist so the underlying cause can be identified and treated safely. Stay tuned until the end of the video to see the final result.